pencils. I'll look at the camera.
Welcome back, everybody, to Midday. The flu is just yucky right now. It's in so many states across the country.
Everyone has had it.
Well, if you see that nationwide map, like Utah's right in the center, we have Dr. Jason Church here from Ogden Clinic's Mountain View location, and I'm so glad you're here to help all of us know how to maybe not get it, or if you do have it,
nip it in the butt.
What to do? I think it's bud. Is it
no,
butt?
It's butt. Oh. Nip it in the butt, and not with the flu shot.
That's not usually where you get that shot. How bad is it in Utah right now?
Right now, it's on the rise, pretty bad. Compared to last year, it's actually lagging behind a little bit, but we're on that sharp upslope that we saw last year.
Look, I want to ask you, and let's be real about it. Has it got a lot to do with your diet and lifestyle? That your immune system's down. That's why you're getting the flu. True?
No, not at all.
Okay, good.
Yeah, not at all. Everyone has the chance to get exposed to the flu, and one of the reasons that we're seeing the steep upshoot right now is after getting together for Christmas with our family, especially with lots of kids. They're sort of the little germ factories that we don't know are sick, whereas with adults, we know that they're sick.
So you're saying not to be with the family and kids?
Absolutely.
Is that why you've been staying away from my children?
Yeah.
Is that why?
That's why I haven't seen your kids.
H1N1, is that the strain that's out there right now?
Right now, that's predominantly what we're seeing is the H1N1, which is the swine flu virus that we saw in 2009.
Is that a tougher flu than the common flu?
It's not tougher, but it does cause a lot more symptoms in the younger generation as opposed to the older generation, the over 65 population.
Okay, you just said swine flu. Isn't that quite a dangerous type of flu? Isn't it?
Well, all flu has the potential to cause death, yes.
Okay.
And significant illness for sure.
All right, #1 way to prevent getting the flu if you haven't already had it.
#1 way is vaccination, of course. That's the best way to prevent getting the flu.
There are different types of vaccinations, depending on age, or?
Well, there's just one vaccination.
Okay.
Actually, there's a couple vaccinations, but the main vaccination this year is a quadrivalent vaccination.
How soon are you protected? Immediately after the shot?
It takes a couple weeks.
Really?
Yeah, a couple weeks.
Okay, but it's still a good idea to do it now if you haven't,
Oh, absolutely.
if you haven't got the shot.
Yeah, because there are different peaks to the flu season. So right now we're seeing a lot of influenza A, but later in the spring, towards the springtime, even as late as April, sometimes even May, we'll see a second surge.
People say, oh my gosh, I've got the flu, but they've really just got a cold.
How do you know?
What's the difference?
Well, my PA Zane Williams and I in our office, one of the things that we joke about is the difference. When you walk in a room and the kid's laying on the table sort of in that fetal position, doesn't really open their eyes and look at you. That's the difference between the flu and the common cold.
You just feel absolutely lousy.
Yeah, you do. You have no
Bones
energy.
are sore.
I mean, you have the high fever, the sore throat, body aches. It's just you feel a lot more wasted than you do with the common cold.
It's been going around the station. Maybe we need to bring shots here.
No,
We have all sorts of things. Sterilizing
Everybody,
hands.
I know.
We've got Sanity's wipes.
Yeah.
I have a bubble in my office that I sit in most days.
Don't come out of that bubble.
Yeah.
Just stay right in there. Ogden, well, if you do come out of the bubble, go to the Ogden Clinic and get your flu shot. Or with any questions, you can always ask them. They know what they're talking about. Dr. Jason Church, thank you so much
Thank you for having me.
being here. Glenn and Emily, back to you.
Great advice.
You know, we got our shots here at midday just a couple months ago.
I feel like $1 million.
And we haven't been sick.
And we didn't get any.
Yep, we're all good.
Stay away, you two.
We're going to be sick any minute.